Layla is performing a venous Doppler ultrasound of this male patient's right leg. Venous duplex imaging is used to evaluate blood clots, venous insufficiency, incompetence, or tumor masses that may be obstructing veins. Acute and chronic thrombosis can be differentiated. In addition, this procedure may be used to detect superficial phlebitis and obstruction. Patients at an increased risk for lower extremity peripheral venous disease may include those with a previous deep vein or superficial vein thrombosis, lower extremity trauma, immobilization of an extremity, recent major surgery, prolonged bed rest, history of cancer, family history of DVTs, pregnancy, congestive heart failure, or similar cardiac problems. Venous Dopplers can be performed of the legs or even the upper extremities. Upper extremity venous disease can be caused by recent trauma or recent or past surgery, previous dialysis graft placement or catheter placement, central venous lines or chemotherapy access port insertions, and a history of cancer. Some of the main indications for venous Dopplers are deep vein thrombosis, extremity swelling, vein mapping needed prior to surgery, upper or lower extremity pain, skin discoloration, varicose veins, open leg sores, phlebitis, or edema. Right now, Layla is scanning the patient's right deep venous system, and this would include visualizations of the common femoral vein, the greater saphenous vein, superficial femoral vein, and popliteal vein, as well as profunda veins. It's typically performed using grayscale imaging, color flow imaging, as well as compression techniques. Doppler interrogation of the vessels is performed to show normal phasic venous waveforms and the appearance of the waveforms after augmentation. Right now, Layla was demonstrating color flow and compression technique that is used to visualize the entire course of the deep venous system. Once again, this exam is non-invasive, does not require any patient preparation, is painless, and without the use of any ionizing radiation.
Different regions of your brain control different types of eye movements, pupillary response, and optokinetic function. Through video nystagmography, we are then able to analyze and determine where the deficient regions of the brain are. From here, we're able to develop training programs to revitalize the problematic areas, harnessing brain function through eye exercises and other therapies. It is important to understand that general eye movements are not therapeutic to the brain in most cases. If not in the specific planes of deficiency, you may be exercising a part of the brain that is already working too hard, which can be just as problematic as areas that are not working enough. Therefore, we are very careful to develop plans along specific patterns to restore signaling in the brain, resulting in healthy neuroplasticity, or a change in the brain. Neuroplasticity is created by connecting as many neurons as possible. An analogy would be a supercomputer, which is created by connecting many servers and devices to create incredibly fast processing speed. We are attempting to create the same processor in our brain by giving it as many connections as possible. Once the brain starts to receive this activation, it develops more neural connections, creating neuroplasticity as previously discussed, but now it continues to develop on its own, as it has the speed and juice to accomplish the task, where it wasn't able to before. Just as a negative thought can determine our mood, neuroplasticity dictates the health of our brain. It's all about processing speed. Neuroplasticity equals processing speed. Once the brain starts to function with efficiency, we notice that depression, anxiety, fogginess in thought, ADHD, learning disabilities, memory, mood, motivation, analytics, music appreciation, dizziness, vertigo, migraines, fibromyalgia, athletic performance, post-concussion syndrome, heart rate or rhythm, blood pressure, posture, joint angulations, and muscle spasms can greatly improve. This is a long list, but it's just a few of the things that can be improved when our brain improves.
VO2 max and anaerobic threshold have long been accepted as the ultimate fitness assessment. But due to cost and complexity, these powerful tools have only been available to high-end professional athletes. The rest of us were left to settle for substandard calculations and estimations. Well, no more. Cardio Coach is accurate, affordable, and provides data for fitness professionals at every level of expertise.
My name is Joe Rogowski. I'm a trainer for professional basketball athletes, and I've been using the Core Cardio Coach for about 5 to 6 years now. The Cardio Coach is a metabolic cart that we use that's very portable, easy to use, that allows us to test our athletes from a physiological standpoint. It gives us anything from heart rate to lactate threshold to VO2 max. It's very user-friendly. I mean, it's a lot of touch buttons. You can actually hook it up to your laptop and work off of that. And you know, for the most part, all you have to do is hit start and it runs itself. There are other pieces of equipment out there, but just through my research and my own testing, this equipment seems to be the most reliable and the most valid. It's quick and easy, and that's what you're looking for as a trainer, something that's quick and easy and comfortable for the patient or athlete to use. I've worked with some Olympic athletes as well, and some athletes that were in Beijing, and specifically the Lopez family. I tested them out, and we were able to track their lactate thresholds and their heart rates, and see a significant improvement prior to the Olympic Games and when the Olympic Games actually came about. And we were able to analyze and see the significant difference, and that's, I think, one of the reasons that helped them medal at the Olympics. My favorite thing about using it is just the amount of data it gives you, and it allows you to be creative as a trainer, as a medical personnel. Whatever your area of expertise is, it sort of allows you to dictate what information you want to give the athlete or the person that you're testing, and formulate a different plan of action for them and how you want to train them personally. And it gives the person that you're testing some confidence that you are directing this personally for them and not just taking a cookbook approach. As a trainer that works with high caliber athletes, you're looking for any advantage you can over the competition, and so you're always looking at the newest technology and what can benefit your players, your athletes the most. And the core medical VO2 cart is actually something that we've seen some positive results with, and so we utilize it.